Hey guys. So I have a pretty difficult case today, and like a good old doctor, I am hitting the books just to make sure I didn't miss anything. It's actually a pretty severe jaw case. This woman was at the dentist for like 5 hours having a procedure, and when she was done, she can't open her mouth. So I saw her once already. I was able to get rid of her discomfort, but the jaw did not unlock. So I'm just going to refresh myself on some of the various things that I've learned before going. That's how you achieve a level of mastery. You don't assume you know anything, and you go back, you hit the books. How's everyone doing? So I'm gonna eat my breakfast, a beautiful salad from Whole Foods, drink my water, and review this while we get asked questions. We're gonna see if the comments are delayed this time, but they don't look like they are. Hello all. So, just reviewing there's about 300 different treatment options for the jaw. I could go about it. So I'm checking to see if there's anything I need to review before I see her. Did I clean my house? My house was never dirty. As you can see, this is just the arterial blood supply of the jaw. So I have to look at compressed arteries, compressed nerves, compressed veins, the fascia, the disc, a lot of options. So it's been a while since I have reviewed treatment of arterial blood supply of the jaw. So time to do that now. So if you guys have questions, I'm willing to answer this. You guys can come on live with me if you like. The pterygoid mandibular ligament. Yeah, didn't treat that one. this one. Hard part with removing these notes is they're in French, so I gotta translate. Closure. Okay. So this is, if you want to go just the fascia, it's two pages of techniques, about 35 techniques, just for the fascia. Then I got to go to the arteries, the veins, the nerves, and that's just for the TMJ, just this little spot right here. And then I have to look at everything in here and then back here. So I'm basically, I know most of these techniques, but I'm establishing a game plan before I go back and see this patient. Because she can't really eat right now because she can't open her mouth. So 2 days ago, made some progress, but not as much as I'd like. So, time to hit the books. Temporal fascia. It's a good one to do. Frontal parietal fascia, maybe. Normalization of masseter, already did that. The Parodian fascia. Articular fascia, intrinsic, platysma, did that. Auricular fascia, maybe. Somebody wants to come on here. Ask a question. I'm a little reluctant. This might be somebody that's a little inappropriate. Hey, muffled about. Hello.
Hi, Dr. Dean.
How you doing? I was a little worried you were a fake person because I wasn't sure about if you were real.
I have a fake page, fake profile.
No. I was just worried that you might be.
No, I'm not fake. No,
Okay.
I'm following you for a long time. Yeah.
Okay. Well, I'm doing a little. Excuse me, talking while eating. I'm multitasking.
Yeah, I know.
I'm doing a little question and answer. Do you have a question?
No, well, I would like to see how you would be working on the lady with the mouth.
Well, last time I did like a general loosening of the entire jaw and upper neck,
Okay.
and then I worked on all the muscles that go from the styloid process to the hyoid bone.
Yeah.
These guys are intricately linked to the jaw.
Okay.
And she felt less tension in her jaw, but her jaw didn't open. So now
Oh, okay.
I'm just reviewing every single thing I've ever learned, so that
Yeah.
see if I missed anything, or just kind of brushing up and establishing a game plan. I've already got about 5 or 6 things that I'm like, I should have done that.
Oh, okay. So you have to go back later to do that.
Yeah, I'm going to see this patient at 3 o'clock.
Okay.
This
Okay.
is the
Well,
only time.
I know you'll get the job done this time.
Hopefully, yeah.
Yeah.
I think she'd like to. I think she'd like to be able to eat again. So yeah.
Yes, I know. I know. She can't eat. That's kind of sad. Yeah.
She can drink through a straw, but she can't she
Yeah, I
can't
know.
chew food.
Yeah. Back years back, I had a procedure, something wrong with my mouth too. So
Yeah.
yeah,
Well,
I had to use a straw.
yeah. Well, when you're at the dentist for 5 hours with your mouth open.
Yeah. Yeah. All right then. Nice talking to you, and thanks for taking my call.
You're welcome.
Okay, you have a great day. Okay,
You too.
thank you.
Bye.
Okay, bye. What she does
Okay.
now.
All right. Well, anyone wants to jump on here and ask questions, maybe some of your questions will stimulate me to think about something that I haven't yet. Grind your teeth and you get a lot of headaches. Well, there's all kinds of mouth guards and stuff like that. I would check into your magnesium levels. It's the most common deficiency on the planet, which can make you stiff there. Obviously, stress. Stress will make you grind your teeth. Or if your jaw's too tight, which is what we're working on now. So, I mean, the easy thing, one of the things I do to loosen up my own jaw sometimes is I just get on the meat of this muscle that's kind of tender and rub up and down. It'll hurt. And you just wait for that pain to decrease by about 50% and then see how your jaw feels. Obviously, consult a healthcare provider prior to doing, but this is what I do for my own jaw. Yeah, guys, they're mass reporting like crazy right now. They've been trying to take down my page for years. So just hit lots of those heart buttons. Hit like, share, comment. Can't let hate in the world win. Intrinsic ligaments, boom, 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 boom. Yep. Closing pumping. I need it. That's one that I forgot about. That's a money move right there. How did I forget about that one? Silly doctor. Will going to the chiropractor help with shoulder muscle spasming? Depends on the chiropractor. Honestly. Intrusion pumping bilateral. Yep. Intrusion, need to do that. So, intrusion, opening. Okay. Need to do that. Intrusion. Explosion, yep. I don't think it's a venous pumping issue, but it could be. No, guys, I even have to consider the veins. Because their mouth is open for 5 hours, a vein or artery could be, your flow could be reduced. I might have to fix that to open up the jaw. Now, granted, a lot of this is like, gotta get I've already treated this patient, so I know it's stiff and that kind of thing. And now I'm just looking at it from different angles. I mean, 90% of the time, I nail it on the first go, but the human body's pretty dang complex. So the only way, internal, external jugular vein, mobilization of the supratemporal vein, fascia, did that, intrinsic fascia, Hurdles ligament, didn't do that one. The mandibular bracket, bandulet. I don't even remember what that is. Sometimes they use different words in French, so I have to like look at what we call it here. Fusional contact relation. Go on. If you guys have questions, you guys are welcome to jump on here. I am just got an hour before my first patient, and that's all the time I have today too. Well, that's all the really that I've been so busy this week. It's really all the time I have this week to try to get this lady to eat again. She's already been to like 6 other therapists, so I need to make sure I get it done. Yep. Not that. I needed one superficial fascia. I did not check that last time. I'm loving this logic. Somebody's saying because they've never seen me feed my kids. I don't show all aspects of my life. I make my living doing this stuff, not social media. I'm mainly just here to help people, educate people, which is my life mission statement. And as pretty much as an act of defiance, really. Pulled muscle in the shoulder and the arm so bad I thought I was having a heart attack. So there's pain down my arm. If you pull the muscle, I mean, one of the easy things you can do, there's a hole in your neck here. If you think you have a pulled muscle in your shoulder and it's going all the way down your arm, it's most likely, more likely coming from your neck. So one of the things you can do, if it's on this side, tucking your chin a little bit, and then put your nose in line with your armpit. And then just hang out there for 2 or 3 minutes and see if the pain comes out of your arm. It's one of the easy things you can do. And that's pretty much for all arm and neck pain. you can try that. Can scoliosis be reversed? Sometimes. Depends how long it's been there. There are two kinds of scoliosis. There's functional and structural, meaning structural are the bones are deformed, and functional means that it's as a compensation mechanism to some sort of trauma, stress, or otherwise, and that I can fix. Do it all the time. But I can't change the morphology or the shape of the bone. So if the bone is twisted, I can't change that, but I can make the visual appearance of your posture better, depending on the degree and severity. Okay. Osteopathic review done. Now we're going to Italian physiatry. Study chart that I made, that helpful on this guy. It's always helpful to review the notes. Nice little clinical problem. Treat the styloid diaphragm, carotid artery, anterior jugular vein before the cranial vault after a concussion. Makes a lot of sense, but I didn't have that on the tip of my head, so that is why we review. Anybody else got any questions? They can hop on here. Don't be afraid. All right. Healthy breakfast? Check. Let me throw this away. Sciatica? Sciatica's easy. Stop bending forward and stretching your back. So don't stretch out your back and don't stretch your hamstrings if you have sciatica. And then lots of this. That will solve a lot of cases of sciatica. Sciatica is one of the easiest things possible to treat. Retrostyloid muscle, stylopharyngeal muscle. I need to work on all that. Yeah, Scoliosis. Did not do that one. I was eating a salad. About itching where the spine lines along the spine, what causes that? Itching is usually entrapped mechanical receptors in the fascia, which means that your skin and deep fascia is tight. A lot of times when I release it in people, they itch a lot, which is the receptors releasing. At least that's what I think it is. Opening and protrusion of the jaw. Boom. This is the one I need to do. Star. I forgot all about this one. Stylomandibular ligament. It's not like not that I forgot about it. I just didn't consider it be, but now that I look at it, it's like, dang, okay. Oh, yeah, sciatica, is it normal for the leg to go numb? No, numbness is never normal. I mean, it's a normal clinical symptom, but it's not, it means that the nerve is being compressed or altered in a way that's enough to make it unhappy. It's not nerve damage per se, but it is definitely decreased nerve function. Okay. This is the one I forgot about, the stylomandibular ligament. Wait, no, I did this one. Maybe I just need to do it more. This one. Money in the bank. Okay. Make some notes to myself. So jaw case. To do pumping. Yeah. Opening. Yeah. Close. Intrusion. Yeah, look at the venous system. Most important one I did not consider or did not treat enough is the stylomandibular ligament. Money. Contralaterally. Gotcha. All this stuff. You're welcome, Renata Thomas. Bone spur, doc, in my knees. So look, in general, regardless of where we're talking about, in the spine, in the knees, in the shoulder, whatever, bone spurs can be relevant or irrelevant. So depending on your age, we know from like classical MRI studies and X-rays that that once you get beyond a certain age, like let's say upper 30s, 40s, and 50s, you're going to find bone spurs, you're going to find degeneration of the bones and cartilage and that kind of stuff in nearly everyone, even when they don't have pain. In fact, if you take somebody that's like 50 years old and you MRI and X-ray them, you're going to find degenerative changes, even in the most healthy individuals. So it's kind of normal wear and tear in the body. So you cannot do a cause and effect between I have this you cannot definitively in all cases, well, sometimes you can, but you can definitively in all cases be like, you got a bone spur, that's your problem. It is relevant and it alters the mechanics of the knee and such, but generally speaking, the bone spur is not the thing that's generating pain. Maybe what the bone spur is pushing on is what's generating the pain, and you can work on those tissues and change the way that bone spur interacts with things around it to change pain. Can you change the bone spur? No. Can you make the tissues around the bone spur more healthy so that it doesn't hurt anymore? Absolutely, I do it all the time. So it's really dangerous, and in my opinion, for doctors to just be like, we have this degenerative thing, and that's why you have pain, and now the person gets labeled as I have a bad back, bad knee, although that is true sometimes. So now that you got this label, now you're like, well, crap, you just accept, oh yeah, June was late. Oh well. You just accept your labeling, and then and then from a pain science literature, it shows that that increases pain just from the fact that you have a diagnosis of a bone spur. So it's a slippery slope. Can MRIs be helpful? Are bone spurs relevant? They're relevant, but there are solutions. And unfortunately, the general medical community hasn't caught up to the research that says exactly what I just said. Let's put it this way. There's a lot of clinical research, long-term studies. What they do is they take people with knee pain, right? 50% of them get the actual, let's say this is meniscus surgery, 50% of them get the meniscal surgery, and 50% of them think they get the meniscal surgery, meaning they get their skin kind of open and they get sutured, but they don't actually touch the meniscus. The patient population that does not have their meniscus touched, meaning they got a pseudo or a fake surgery, actually have better short and long-term outcomes. Okay? So essentially what that means is people that thought they got the surgery, so like a psychology, it comes into play. And then also like it also shows that getting a meniscal surgery may not be as effective as we once thought. And this is not my opinion, this is clinical research. So hopefully that's helpful. I mean, it doesn't help you make any determinations of what to do with your own knee, but it is helpful. It is valuable and helpful information to know because it is a factor. Let's see. Concerning bone degeneration, are vitamins and natural remedies that you can take to slow it down as you get older or just keep your bones healthy? Yes, exercise. Exercise is the best. Bones degenerate in one of two ways mostly, outside of autoimmune issues or metabolic issues. In general, bones degenerate when they move too little or if they move too much because they're unstable. Both of those instances, exercise is the key. So like, I mean, I have a patient, it's coming in at about, I mean, I'm going to them in about 45 minutes. They have osteopenia, low bone density. And I've been working with her for 5 years now. And I have her on a walking program with some very gentle weights that we've gradually increased over time. And her bone density is actually measurably getting thicker, denser, stronger. And that's just from walking 30 minutes every day. So yes, there's vitamins and like, all that kind of stuff. But exercise is by far the most important thing. One more question. My husband has neuropathy in his feet. We've done everything. Are you talking about both feet? Are we talking about diabetes, that kind of thing? Stay a little bit. This is what I need. Yeah, neuropathy in the feet. That's because I'm giving general medical, general answers to general questions. I can't go case by case. I can't do medical diagnosis on the internet without an exam. It's just like, this is what I do in this case. Internal jugular vein, internal carotid artery, distal cloud. Yeah, okay. You can make sure I get through what I need to get through. So I'll keep answering questions, but I am. Yeah, I love reading my notes. Normalization of the cuculus fascia. We call it the investment layer of the trapezius. So I said F this name, like trying to confuse me with your French names. I'm just trying to, oh crap, spilled my water. What do we got here? GLS, I don't really like that technique. I have better ones for that. PLS, my techniques are better than that. They're easier on the hands. Middle mesenteric fascia. Did that. Superficial, did that. Deep mesenteric fascia, did that. Yeah, I mean, you've osteopenia in a mid-50s. Yeah, exercise is the way. You know, you got to be smart about it. You got to progress. But in general, setting a goal of walking 30 minutes a day is a really good starting point. And not holding your hand, not holding a phone or anything else, not walking your dog, walking with natural arm swing. None of that power walking stuff. And it's got to be fast enough that your arms are naturally swinging without you using muscular contraction to do so. Gastric, genial. I should probably do that one. Yeah, people get on here and spew hate, even though I'm giving out very free, high-end, world-class medical knowledge. But, you know, it's not like they even understand what I'm saying, so. What is the device they use for dizziness? A vestibular, and I don't use any devices. Oh. Paid seminar, yeah. Look, guys, I have a lot of stuff that I want to do, and you know, all this court stuff I've been doing that has basically put me 3 years behind on my life goals of what I was supposed to be doing. But I am trying to make an entire online education series. You know, it's just difficult with time. So I'm very busy, and my practice is booming right now. I'm with my kids. I'm definitely trying to, I was having this health issue that was just sapping my energy. My fatigue was out of control. Getting definitely better. So right now I'm focusing on my health so that I can have all the abundance of energy to do everything that I need to do, which includes making these educational courses. Herniated disc. Need to know, do I need to go to physical therapy? It depends. It depends, honestly. I mean, I know personal trainers that are better at managing disc injuries than doctors. So it really depends on the knowledge and the exposure to these 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 techniques. Truly the problem is with chiropractic and PT, what you learn in school is like 30 years outdated. So you spend like $250,000 getting your degree, and then if you want to be tip of the spear, you got to spend another $250,000 learning from industry leading experts in various subjects, like I did, which is hard to do when you're just first starting out in your career. And I am very fortunate and blessed and grateful that I was able to do so. There's still more things that I want to learn. There's always more. It's like I could spend my entire life learning and do nothing else and never learn at all. There's just so much. Are steroid injections, you're talking about cortisone. So in general, when you inject cortisone into a painful area, what you need to understand is that cortisone injection actually degenerates the collagen fibers around that joint. So it only works if you have inflammation, which only half the time that's even the case. So usually cortisone injections are around 50-50. They're either magic or they do nothing. But regardless if they work or they don't, you're actually making whichever area, let's say you're doing to your shoulder, you're making your shoulder in the long term more unstable and more prone to problems, especially if you get multiple injections. So you can make your own choice and talk to your doctor. But for me, I'm a little bit hesitant to be like, go get cortisone shots or whatever, because it's a short-term solution at best with potentially some long-term negative consequences. So, and my patients don't need to get cortisone shots that often because I fix the pain. So that's um, that's just my, you know. So I have a different perspective because I have tools to make it so they don't need those things. There are certain very rare cases where I need to have them get the cortisone shot so the pain's down enough so I can actually work on them because they're too sensitive. But those are few and far between. Spank fascia, anterior longitudinal ligament. Oh. Oh. Oh, yeah. What do I think of ablation procedures? I'm assuming you're talking about nerve ablation procedures. Again, I'm not a fan. Again, consult your doctor. This is just a general response, but I'm not a fan because when you burn the nerve, it can grow back. And when it grows back, it hurts usually more than it did before. So it's kind of like a Hail Mary it's kind of like a psychological treatment in some ways. It can be permanent long-term solutions, but it can also, the nerves do grow back. And when they do, they hurt like hell. So again, I'd rather just fix the problem. Most pain is just inflammation, not actually true. If most pain was inflammation, then Advil would kick out most pain. Not all pain is inflammation. Whoa. Somebody text me, my entire phone jumped everywhere. Vestibular exercises, yes, I do vestibular exercises. Dizziness is something I treat probably about once a month. Oh yeah, the vertebropleural band. I used to work on this all the time, and then I just stopped. Why? Silly goat. Somebody says blah 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 blah. All I do is ignore it. The courts don't care, guys. They don't care. 3 restraining orders, hundreds of violations. Nobody cared. California does not care about people. We pay all this money in taxes, and our roads are shit. You guys don't understand California. They don't care about people. This place is a joke, literally. My thoughts on trigger point injections. They can be helpful. Trigger points, there's a big misconception with trigger points because they don't actually exist from a structural standpoint. A lot of people are like, oh, you push on that spot and it refers and that's a trigger point. It means the muscles tighten, all that stuff. Trigger points are actually a neurophysiologic phenomenon. I mean, it's actually in the chemistry. So I have other treatments that I use to address the chemistry that are a little bit more long lasting and profound. But trigger point injections can be a valuable treatment. I just do other things because I find they work well. All right. Let's check out a completely different system. Anybody's welcome to come on here and ask me questions. It's make it a little bit more interactive and fun for me as I let's check out. Tectonic fixation of the ear. Yeah. Guys, just ignore the negativity. They're just not happy with their lives, so they're projecting it onto other people. That's all it is. Let's see. Next torso. There we go. 114. Bone on bone in my left knee. One of the major things I do for knee pain is right here. I just get in there. There's a nerve there called the saphenous nerve. You just kind of free it up. I won't solve the bone on bone, but it is a huge portion of a lot of neck. It can make a lot of pain. 1 second, I gotta go look for a different book. Decided to take my medicine instead. Sort of medicine. Advice on neuropathy. In general, neuropathy is from a compression syndrome, whether it's from a disc or most bone spur and spine or whatever. So whatever it is, like you got to reduce that compression. It's like, that unless it's like, bank just emailed me what do they want. My credit card. So gotta make sure I don't fraud or something. Oh, credit card payments too. Anyways. Yeah, guys. Just fight the haters with liking, sharing, commenting. even if you don't like just comment whatever, even though an emoji, it helps this get to more people because I mean a lot of the information I just said is extremely valuable to a lot of people actually. My eyes are beautiful, thank you. Supplements to increase my nitric acid. Microcirculation. Ugh. Okay, did that. Now I need to look at that one money move. This is the stylomandibular ligament. I think I have a video of that, so I'll review it. Where's it? Stylomandibular. There you are. All right, let's review my hyoid, hyoid, sternocleidomastoid, sphenoid, sphenoid, there we go. Stylomandibular ligament. Just look at the jump on the edge of it. Well, it feels really different. All right. There, yep, makes sense. Ugh. All right, guys. Not getting that many questions anymore. Carrot beet juice. It wasn't carrot beet juice. It's a one of my functional medicine doctors gave it to me. It's like, take this, it'll increase your nitric acid. That's important. And I was like, okay. Oh. Whew. With the bottom of that wasn't mixed up. Oh, man. Oh, that was a good one. Whew. April says, I'm starting a new job in a chiropractic office as an office manager. I've been training to assist with traction. Oh, traction. That means like you're going to be either if it's the neck, you're going to be pulling. If it's the back, you'll have a machine that pulls. It's a pretty good treatment. I would love to get it on my spine. It's not gonna fix everyone, but it's gonna help a lot of people. Thoughts on foot drop caused by nerve damage? Yeah, I've seen a lot of those, and I've fixed a lot of those, but it also depends on how long it's been there. If it's been there, the longer it's been there, the harder it is to fix. So it's like kind of like you know, race against the clock. If you got foot drop, you got to fix it as fast as possible. Hopefully within a week. I'm just going to ban this person. Someone keeps asking me about fibromyalgia. Fibromyalgia. I mean, fibromyalgia is kind of an interesting condition because it's like it just means you have widespread pain. So it doesn't say why you have it. Fibro means connective tissue. Myalgia means muscle pain. So you have pain of the connective tissue and muscles. That's all it means. Doesn't, how do you go about fixing it? Depends. But it's kind of just, it's the same thing as saying my body hurts. So, easiest ways is to look at your diet, take out any inflammatory foods, go on an anti-inflammatory diet, so only organic, everything. Most likely take out gluten, take out the nightshade families, which is like eggplant, tomatoes, that kind of stuff, and start from there. But yeah, it's hard to answer questions about fibromyalgia because it really is just doesn't tell you much in most cases. So yeah, and in my opinion, a lot of times when doctors don't know how to help people with widespread pain, they just call it fibromyalgia because it like kind of takes it out of their responsibility to fix it. I've seen that quite a bit. I have lower back pain and terrible sciatica pain. Dang it, I need to finish that ebook. I get distracted. It's one of the problems of ADD. You start things and then you get distracted. And my schedule is always evolving. Like right now, I work from 11:30 to, speaking of that, I got to leave soon, 11:30 to 6. But very easily by the time 3 o'clock rolls around, I could be done at 8. It's very normal. All right, guys. Well, I need to conserve my brain power for this very difficult patient, or not difficult, involved. I need my A game. So I'll catch you guys later. I'm out now. Thanks everyone for the questions, and I will be doing more case studies soon. Let me see if my mask is here. Yeah, this thing was supposed to be here yesterday. Where's my mask? Come on. All right, guys. Anyways, catch you later. I gotta go. Bye.